Mobile phones are also playing an important social role in the provision of healthcare. In Rwanda, over 300,000 people live with HIV and AIDS, which is why the TrackNet reporting system was developed.
TrackNet is a tool, software tool, web-based, which help us to collect, to retrieve, to disseminate information about HIV/AIDS program across Rwanda.
When we started about 3 years ago, there were 1,000 people on treatment in Rwanda and about 12 centers offering treatment. Today there are almost 40,000 people on treatment, and almost everyone in Rwanda is in reach of a cell phone. The system is actually a two-way system of being able to send out messages, send out information, so physicians in a health center can actually access lab results, for example.
Bidufitiye akamaro kenshi cyane kuko abarwayi tuba twakiriye hano baba batuganye nivo ya ministere ntabwo baba bazi, ariko iyo twohereje raporo kuri TrackNet bahita babona umubare w'abarwayi twabonye mu kwezi, abana ni bangahe, bityo na gahunda ikaba iramenyekanye, bavuga ngo hariya tugomba kubafasha mwiki kuko bafite abarwayi benshi. Ariko iyindi raporo twatanga zisanzwe mu mpapuro zarakererwaga izibashe kugerayo ku gihe, ugasanga rero TrackNet yihutisha raporo kandi mu gihe gitoya, nanone tukabona retro information nanone mu gihe gitoya, mbese idufitiye akamaro rusange.
Gukoresha iyi system bifite akamaro ku bitaro kandi bigafite n'abarwayi, kuko ku barwayi igihe twaherezaga ibizamini byabo muri labo ya Track twabonaga ibisubizo vuba, bityo umurwayi akaba yavurwa vuba agahabwa imiti vuba. Noneho ku bitaro bifite akamaro kubera ko dushobora kubona ibyo bisubizo vuba n'imodoka itarinze kujya i Kigali, umuganga akabasha kumenya icyo akorera umurwayi bidatinze.
From my office, I can be asked for an opinion, and I can even myself ask for an opinion. A nurse who is in a remote health center who can just send to me, take photograph of X-ray, record that X-ray, copy the X-ray, that picture on his laptop or his PC, and send it over through by internet up to my office. Then I can give an opinion. Say, no, you don't have to refer this patient from 200 kilometers. You can just apply a POP, a plaster. Then 1 week later, he sends the check X-ray, and I can give another opinion.
Coverage is the first issue. Coverage here in Rwanda now is very high. In some countries in Africa, coverage is still a challenge. I know many telephone companies are adding additional services, adding GPRS, adding multiple services. Obviously that helps to bring access to rural areas, access to health facilities.
We use TrackNet to communicate our data to the central level so that they can take any kind of decision according to the data they send to them. With this mobile phone, and we use a system, G2Me. It's a new system, very easy to use, because when we send, we have the format in the phone. I can even put the data in the phone when I'm offline. I don't have to be here, just take the report and go home. When I'm available, I send the report.
We believe that we're just scratching the surface of the potential to really put a tool in the hands of health workers and ultimately in terms of individuals to really improve health.
Bangladesh also has severe health problems. To try and improve the situation, Grameenphone created a health information service. Doctors at the Healthline call center provide medical advice to about 10,000 callers a day.
দুই জায়গা থেকে কল আসে, গ্রামীণের যে সাবস্ক্রাইবার যেখানে আছে রুরাল এবং আরবান সমস্ত জায়গা থেকে কল আসে। তো কলগুলি ডিভাইডেড এইভাবে হয় যে রুরাল এরিয়া থেকে যে কলগুলি আসে সেগুলি থাকে হলো তাদের বেসিক নিড, যেমন এনি মেডিকেল প্রবলেম নিয়ে বেশি কল করে, তাদের বিশেষ করে বাচ্চাদের প্রবলেম নিয়ে, তার ফিজিক্যাল ফিটনেস, তার সাইকোলজিক্যাল প্রবলেম, এগুলি নিয়ে কল করে। আর আরবান এরিয়া থেকে যে কলগুলো আসে মেইনলি আসলে ইনফরমেটিভ, যে ডক্টরের ঠিকানা, কোথায় গেলে তারা ভালো হেল্প পাবে, কোন মেডিকেলে গেলে তারা ডক্টর পাবে। ইনফরমেটিভ কলগুলি আরবান এরিয়া থেকে বেশি।
Corporate social responsibility has become a popular way to help and support communities. Ngari Ndari is a forest reserve near Mount Kenya. The Community Conservation Project seeks to ensure the environmental and social sustainability of the forest and its villages.
It's one of the few intact indigenous forests left in Kenya. The type of funding that comes through Safaricom is targeted for environmental community, which is crucial to what we're doing here. And we're working within the communities over about a 5 to 7 kilometre radius, and the communities that surround the forest are the reason that this forest is still intact.
There are 3 main initiatives to improve living standards in the community.
There is the kitchen garden, which is actually supplying vegetables to the household. The other 2 are the wood stoves, which are actually being used to reduce pressure that is exerted in the forest, in the sense that they use less firewood as compared to the traditional stoves. The third initiative is actually the improved the dairy goat breeding, which is actually reducing the need to keep a big stocks and therefore reducing pressure that is exerted in the forest.
This is one way that Safaricom gives back to the community some of what the community is giving Safaricom. We also want to try to alleviate some of the issues around poverty, around the lack of certain basic facilities in the rural areas.
Bangladesh may be one of the fastest growing mobile markets in Asia Pacific, but it faces an acute shortage of skilled workers to meet this growth.
Chittagong Skills Development Center was initiated in 2003 by Telecom Malaysia International and A.K. Khan Foundation of Bangladesh. The digital divide is not only between the developed and the developing countries, it is within our own countries, I believe very strongly that if we want to come out of the poverty trap, this is the way to do it. You have to provide education, basic skills to the people. And we are only giving them generic, basic concepts, not too complicated, like fiber laying or maintenance of BTSs, or how do you keep generators in the villages, fueled all the time. But these are important functions for a network operator.
20 years after the concept of global mobile was first developed, the world has changed forever. Many challenges lie ahead. Providing guidance and direction is the GSM Association.
Our role is to act in many ways as a facilitator, collaborator, doing things like creating and facilitating new products and service and segments. So, for example, things like the Emerging Market Handset Program. We're looking at interoperability to ensure that these things can interoperate, so not just in a country but around the world with our 700 operators.
Mobile phones have become a necessity for people all over the world and in all walks of life.